In this video, I'm going to go over needs assessment and the bigger picture of program planning and highlight a couple other perspectives that I think are important to have for needs assessment, community health needs assessment, as well as your projects this semester. So what I wanted to start out with is sharing about the generalized model for program planning. So this class is needs assessment and program planning. And this chapter that you read goes into program planning. I'm going to hold off on some of that content till we actually get to planning the program part of it later this semester. But that's why I wanted to bring in this generalized model for program planning. It does provide the framework for almost all models in program planning, and so felt it was really important to share with you here. So the first, there's pre-planning. You'll get a team together or a committee to design your needs assessment, community health needs assessment and program. But the first key step of the generalized model is assessing the needs. So before you can plan a program, you need to do a needs assessment. So that's where we're going to focus on the needs assessment portion on the first half of the class this semester, and then go into program planning. Once you've assessed the needs through different methods of collecting and analyzing that data, then you can create those goals and objectives and what you plan to accomplish based on the needs and the information that you've found. From there, you can then develop evidence-based interventions. So this course, we are really going to do these first three aspects of the generalized model. So you're going to do a needs assessment on a topic and then set goals and objectives for a program and actually develop or design some interventions, including a logic model. So interventions are all those activities on how those goals and objectives will be achieved. Then, of course, you put those into action and implement them, and then evaluate the results. And so the implementing and evaluating, you will get more in the implementing and evaluating class. So the other thing is, this is the proceed model. They'd mentioned this in the chapter. We'll come back to it later this semester when we're looking more at logic models and developing your logic models. But this is really used a lot by CDC in a variety of different health issues and topics. It does start with the social assessment or the larger outcome in mind. As you can see, it goes backwards here. But I pulled this one out in particular, one, because it is a form of a logic model that's used, but so that you can also see the aspects of the generalized model and how it plays out here. So the needs assessment or assessment is going to be happening at the phase 1 through 3, particularly. And then you would develop the health programs, align it with policies, and develop those interventions in phase 4. Those first 3 steps of the generalized model, and then the implementation and evaluation after that has been designed. So we will cover this more a little bit later in the semester, but I just wanted you to see that. Also, if you remember in the textbook this week, you did look at epidemiological assessment, public health assessment, that type of thing. And so you'll see them aligned here. So when you are doing a new needs assessment, you need to realize that they are diverse. People's needs and capacities are ever changing. And so there's not one single approach to assessment that's always going to be appropriate. So you want to have a toolbox of different types of methods for gathering information. So the variety of approaches is going to be necessary. So thinking about having both quantitative and qualitative methods and for gathering information, and having both a sort of a mixed methods approach is going to be the best. And so this table here just kind of goes over the differences between quantitative and qualitative, which I know you've all had, but wanted to point this back out, especially when we're working with communities and we're talking about their needs and their perceived needs. That's going to come out a lot more in the qualitative approaches when we can start talking to the people more and learning what they need. So different changes over the last decade. I'll just get out of here so you can focus on the slides. So definitely it is incorporated more into professional responsibility. So more people's positions actually have needs assessment in their description of their job. there is a broader context of needs being assessed. And so we'll briefly talk about the different types of needs, but they gave an example in the book about how, until those perceived needs are met with the community, are you going to be able to address the other types of needs, the relative and comparative and normative needs. There is more individualized assessments also out there, and we'll talk about those. There is a wide variance on how community health needs assessment, how needs assessment, just assessment is defined, and just a wide variance in how community is defined as well. And we'll talk about that. Community-based participatory approaches to assessment is key, and getting people involved and involving the people most affected by the issue. There's also a continuing emphasis on capacity analysis. So also looking at capacity. So we're looking at strengths and assets of a population and not just their needs. We want to be able to empower them and build the community and the individuals up in that community so they can take ownership and ultimately improve their health and their community and resolve the issues that have been identified. Large scale community assessment formats are growing, and as you read in a couple of the readings, a community health needs assessments are required by under the Affordable Care Act for all nonprofit hospitals, and it is in their best interest to partner and collaborate with many organizations. And then also using assessments into different emergency circumstances and doing those rapid assessments is really, really important. So these are some of the types that were highlighted in your chapter. So you need to be able to look at the organizations involved and their capacity and willingness. When you get to actually having a program particularly and knowing the market and what's going to draw your intended audience, you would do a market analysis or assessment. Of course, the needs assessment, and we're looking at what problems exist and to what extent. Then at the community level and community health, what are the health problems and the resources that are available? And that rapid assessment, these are often used after emergency situations particularly. And then finally looking at workforce and seeing if there's the human resources that are going to be in the community and available and at the level of expertise needed to address the health needs. So those were gone over, and I just put this in here quick to remind you that when you're thinking about who to assess, thinking about the different levels and units. So you can look at individuals that are particularly affected by the issue, patients, clients, or other community members. You could look at families, more neighborhood type levels, people that have the potential to interact. People can also be have that potential around a health issue. They may not be more of a virtual type community, and looking at until you get to the total set of individuals. I wanted to also mention this ecological perspective. I will talk about it too in environmental health if you have me there, and maybe even a little more detail, but this is also kind of looking back at those units or levels of assessment and who you would be looking at. So that interpersonal is the individual, and thinking about how their own knowledge, attitudes, beliefs, and personality traits are going to affect the issue. So if you're looking at diabetes, what do they know about diabetes and their risk for diabetes? And do they believe it's important enough to change their bad behaviors or change their lifestyle so that they reduce their risk for diabetes, for example? The interpersonal level would be those primary groups that are that interact with them. So family, friends, peers that provide that support or not support. So you could find gaps in where those interpersonal processes need to be built up. And then in the community, you can look at institutions, schools, and workplaces, and the regulations and policies and different structures, both informal and formal, that can constrain people from making recommended behaviors. Looking larger in the community, and looking again at formal or informal networks and norms. And then finally, policy level. So all of these are multifaceted, they interact. And so when you're thinking about how you're going to look at your problem, you can look at it at these levels, or how these different levels interact, and how people interact with their families and their institution and community, and how that aligns with the policy. So these were the types of needs that highlighted in the textbook. I also threw in Maslow's hierarchy of needs here for you, just so that you realize we need to look at all types of needs. You know, so the express, normative, and relative are going to often be found by health professionals, for example, looking at, you know, with the express need, just how many people are actually using the services in the community. If you're looking at utilization rates, and if people from the intended audience are going to be interested in the service or program that you have. The normative, those are set a lot by research or evidence. So then we can make comparisons to that. And then relative are often shown in disparities. And so it's the contrast between advantage and disadvantage. But again, these perceived needs or felt by the audience are going to be really important. If their perceived needs are not being met by an organization or program, they may find it difficult to trust or want to work on other ones if their perceived needs aren't being addressed. So just other things to think about. Some different challenges that occur with needs assessments and community all types of assessments. Those that are receiving the survey and responding to you, or the services, excuse me, are going to be different from those not receiving, obviously. So they're going to maybe more difficult to survey. For example, if you had more random selection through a neighborhood or community, you could get maybe both that way. There is bias with people and their responses, especially around their needs and what they think their needs are. So just be prepared for that. And also assessments can be really costly and take a long time. So the Lynchburg Community Health Needs Assessment, which you looked at this week, that is going to be happening every 3 years. It's been in the works for this next one, so getting a new one in 2022. But it takes a good year to get the survey redesigned, distributed, focus groups. They do focus groups in there as well. And then, of course, analyzing the data, putting the data together, and disseminating the data. So the 5 perspectives on community health assessment that were in your textbook are here. You're going to actually, for your secondary analysis or literature review on your topic, which is an assignment that's coming up, you're going to be integrating a few of these different perspectives in there. So epidemiologically, we want to know who is affected by the health problem, how bad it is, how many people die or are sick from it. We can look at financial or social costs linked to that. But then there's also the whole separate social perspective as well. But these different perspectives, particularly the epidemiological, public health, and social, you're going to be looking at other evidence-based surveys, national surveys, local surveys, databases, peer-reviewed literature to define that problem. And we'll talk more about that too in a couple weeks with the chapter coming up. The asset perspective, we do want to see what their perceived needs and their strengths are too, to help build that capacity and empower them. And then actually through this semester, that rapid perspective is going to come into play. So you're going to take a few different hats and different perspectives on your project this semester, because we're going to sort of rapidly assess the problem that you're looking at. So you're going to do that through interview, observation, and photography or photo voice. So you'll use multiple methods to rapidly in a couple of weeks, determine some of those root causes and how to develop a program for them. And then there was a short video on Moodle about the collective impact, but the Lynchburg area, the Partnership for Healthy Communities, who is in charge of the community health needs assessment here in Centra and the community, they use this perspective or model, and will be what maybe you hear more of as more and more communities adopt this perspective and approach to community health needs assessment. So the conditions for this perspective is that there is a common agenda and an understanding of the problem. So there's a shared vision for change between a lot of different stakeholders within the community. So the hospitals, the nonprofits, and people that are affected by it. There's shared measurement and shared accountability for that. So in the collection and the measuring of the results for that. There is coordination and mutually reinforcing activities. So people are working together, and there's constant communication. It's continuous. So that helps build trust and open communication through all. And finally, there's a level of backbone support. So a separate organization with staff, which is the Partnership for Healthy Communities, that can help and convene and bring everybody together. Unfortunately, it's not just here in Lynchburg, but it has happened here in Lynchburg over the years that I've been here. But in many, many communities, that organizations work in silos, that hospitals work in silos. So that's not that you're going to get maybe some of the same results that way, but you're not going to really get the whole of the community that you want to get if not everybody's on the same page. So that's that collective impact. And then once you have the data, then there's these 4 key phases that the collective impact model uses, so convening people together, having strategic planning, making sure you're involving the people that are affected, and you're facilitating outreach and building public will, and you're constantly evaluating that and building some key indicators that you can measure across the community. So you will hear this model probably going forward, but also if you do get involved in the area at all in the community health needs assessment and stakeholder strategic planning events and things like this, you'll be aware of what they're using. So just a couple more slides here. This is former U.S. Surgeon General David Satcher, and he quoted that we need a new way of thinking, one where as public health professionals, we lead by taking an interdisciplinary approach and collaborating across a wide range of disciplines, developing our own workforce to effectively address social determinants of health, and insisting health and non-health policies incorporate a social determinants approach. So I pulled out 2 key things from this quote. One is that interdisciplinary approach and involving people from other disciplines here on campus, but then also interprofessionalism and working with different organizations in the community to tackle these community health problems, because they're connected, and those social determinants of health really do link those. So we need to look at people working interdisciplinary among and reaching people in these different social determinants. So social determinants of health, if you're not familiar, or I'll remind you here, are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life that ultimately affect a wide range of health risks and outcomes. So this was both with the World Health Organization and CDC, but the 5 main social determinants of health, this is the model actually from Healthy People 2020, now 2030. But you're looking at neighborhood and built environment. So where people live and how safe it is, for example, in that built environment, sidewalks, lighting, things like that. Access to grocery stores are going to be in that neighborhood and built environment. Health and healthcare, and having access to healthcare. So not just, you want to have physical access to pharmacies, to providers, to dental care, to public health. There's also the quality of services and having culturally competent providers and care as well that affect access. The social and community context was where we've got resources that come in and help people. This can also have different aspects around crime and violence in a community, or safe place to play in the area, and the resources that are available for locals in that way. And then education, having good education system and schools, STEM programs, things like that, that are going to help people live healthier lives, be educated about it, but then also economically, which links to economic stability and the socioeconomic status and people having enough financials to be able to live healthy and have healthy lifestyle and whatnot. So I wanted to point these out. These are going to be really key. And also a lot of the, so when you are looking to define your health problem, you want to think about it in the context of these social determinants of health as well. And that you're thinking of the community and population that you're working on. So looking forward and how you're going to connect all of this, this week's readings and to your project. The next thing you're going to do is actually pick your topic. So you can use that Centra's Community Health Needs Assessment, which was the last one from 2018 to 2021. And I encourage you to look through that. And there's a list in there, but to pick a topic that you're going to be interested in exploring. If it's not in there and you want something else, please let me know. You can also choose to make that topic more specific, as mentioned in the overview video, but you can look at a certain population that's affected or a particular neighborhood and things like that. So in one paragraph, identify the topic, describe why you picked that topic. Excuse me, identify a more specific community and or population that is affected by the problem that you think you would like to explore. So that's really just saying, where are you going to be doing this at? So what's the community or neighborhood, and explain why they would be important to assess. So you will use the Centra Needs Assessment, that's the Centra Needs Assessment results, and any other online resources you help to help you decide. So that could be the Healthy People 2020 has some good lists as well. And then what you're going to do is a 2 to 3 page sort of secondary analysis, lit review of defining that problem. And you're going to include a problem statement, but this is going to get you started. So if the chapter 4, when we get into chapter 4 and looking at how to identify the problem and create a problem statement, but this is going to be helpful in learning more about your health problem and topics. So you can look at these questions as prompts and get started. I do want a minimum of 6 peer-reviewed and evidence-based sources to prepare your paper. Google Scholar, Healthy People 2030, and other evidence-based sources. So more information will be posted on Moodle, and just again, think of how we're going to be looking at your topic in detail and then developing a program later in the semester. So later in the semester, we'll come back to a few things in this chapter as well that were more on the program planning side and the models that are linked with that. So right now we're going to focus on the assessing needs aspect, which again was that the first big piece of that generalized model.